We are doing them a special deep dive. Bloomberg Business Week Daily. We're talking about health technology and healthcare, and more on that specifically when it relates to women's care. And there's been some research that's out.
Yeah, the Menopause Society reporting that osteoporosis, which is highly prevalent in postmenopausal women, has long been associated with an increased risk of fractures. There's a new study that suggests it may also increase women's overall risk of death by as much as 47%, especially within specific ranges of bone mineral density. Results of the study were published just last week in Menopause, the Journal of the Menopause Society.
And it's not just women, it's men too, although women have a higher prevalence than men. Let's get into this. It's somebody we've talked to before about this area. It's great to have back with us Dr. Doug Lucas. He's orthopedic surgeon leading the clinical side for bone health and longevity science over at LifeMD. He's here in studio. He also has his own YouTube show. It's called the Dr. Doug Show, Longevity Through Bone Health. Welcome back. Nice to talk with you again.
Thank you for having me back.
I have to say, I was surprised. I think we were surprised kind of reading in that, yes, it impacts both men and women, but it's more prevalent. It seems to be much more discussed about for women. Why is that?
Well,
I'm not complaining. I'm glad we get attention somewhere, but it impacts all of us as we age.
True. It is more common in women simply because women have lower bone density to start with. So men just have a bigger room to lose bone density before they actually reach that threshold of osteoporosis.
So when we think about it from what new research has told us or given us, is there any indication that we can start doing stuff earlier for preventive measures, eating differently? Last time you were on, we talked a lot about what's being done with hormone replacement therapy. What does the data say? What do the data say?
Yeah, so the challenge with osteoporosis is that in the conventional model, we really look at it as a chronic disease. And like most chronic diseases in the conventional model, we tend to just think pharmacology or maybe surgery. But like most chronic diseases, osteoporosis does respond really well to dietary interventions, exercise interventions, potentially even some over-the-counter supplement type things, depending on what your diet looks like. So there is a lot of room for opportunity to actually improve bone density.
How early, though?
Yeah.
Well, we start losing bone in our early 30s, both men and women. So I would argue, let's start as early as possible. Let's learn what our bone density is, what our trajectory is, and then intervene when we need to.
Are the health insurers, game for this, for you to start early? Because it just feels like there's so many parameters about what's okay in terms of testing.
Yeah, it's difficult with insurance because insurance is generally going to want to pay for the doctor's visit and the drugs if you need them, if you qualify for them. Prevention is challenging in our conventional medical model.
Why is that? Why is that? We're supposed to be about preventive medicine. We've been talking about that for years, and yet...
Well, we're better than we used to be, so
Okay.
now some preventive services are covered. But the system as it's built is just not good at educating on nutrition in a way that's meaningful for bone health especially. Not good at focusing on sleep because these things take time, they take a lot of question and answers and back and forth and accountability. And the system's just not built for it.
But I guess what I don't understand is in the long run, wouldn't they save resources? Would it mean less stress on the system? And by system, I mean for our own bodies, but also the health system.
Yeah, I mean, financially, if we could prevent chronic disease, of course the system would spend less on chronic disease. There just isn't a way that I can see in the system to do that.
Yeah, I mean, I think about this too, like what, I was thinking about your YouTube and what you must focus on, and I don't know if people can call in and ask questions, but I mean, what are we all doing wrong when it comes to bone health? So if we have to be kind of our own activist,
we have to.
Right, an advocate, what should we be doing from age 30 on?
Well, I love looking at, you mentioned my YouTube channel, the longevity piece, right? I love looking at bone health through the lens of longevity because I think every 30-year-old wants to live as long and as healthy as possible. And when you look at it through bone health, it gives you a recipe for that. So the diet that's good for bone health is good for your brain, it's good for your heart, it's good for your skin, it's good for your energy, it's good for your sleep, right? So focusing on eating a protein-forward whole foods diet gives you all the tools that you need. Exercise that gets you out and moving, resistance training for your muscles, potentially impact for your bones if you can tolerate that. Those are the foundational pieces. And then you can just keep stacking on top of that. Better sleep, better mindset, potentially hormone optimization for those that qualify.
Yeah, I mean, the food, there's a lot of stuff that we can dive into here. I want to dive into the food part a little bit. Do you think there's a misunderstanding?
I want to take notes.
Yeah, well, do you think there's a misunderstanding about saturated fats? Because if you think about a protein-forward diet, some people might say, wait a second, if I'm going to eat all that yogurt, for example, to get all that protein. Then I'm going to just blow past what the USDA recommends for, or FDA recommends for saturated fats. Are we a little behind when it comes to this stuff?
It's challenging because if you look at the saturated fat recommendations, it's for the entire population. But the entire population is not sensitive in a bad way to saturated fat. So we have to kind of step away from these global recommendations from a nutrition perspective and start getting really individualized. What I need to eat, what you need to eat, and what you need to eat are all different. So yes, I think saturated fat and dietary fat in general has been demonized in a bad way, and so people are afraid of it. And that does result in less protein, especially from animal sources being consumed.
Like, I do think about that with nutritionists. Like, should we all be seeing a nutritionist early? Like, I can see your kind of, your facial expression, not so sure. Why?
So nutrition's a very challenging space. There is honestly not great research because it's difficult to do nutrition research in a randomized control trial meaningful way. There's too many inputs. So a lot of the older mindset in the nutrition space is really set off of these dogmas from the 50s, the 70s, the saturated fat, dietary fat restriction that really no longer applies and has been hurting us for a long time.